Reproductive rights are a major public health issue and an important conversation among the public. As public health professionals plan for the future of access to this critical healthcare service, we're joined by the National Organization for Women, or NOW President, Nunes, to discuss her organization's work in reproductive justice and what's next. Kristen, thank you for being here.
Yes, thank you for having me today.
Okay, so it's been a little more than 2 years since the Supreme Court decision striking down Roe. How has the conversation around reproductive justice changed since then?
The conversation about reproductive health being important and necessary has continued, and our position for now, with abortion being legal, has continued. That's always been our position. But the conversation has become more necessary and urgent as we are watching women, their lives become at risk. We're seeing people die. We're seeing people denied care. So now what we have to do is, all those who are advocating for women's rights and bodily autonomy, we have to become more urgent. We have to put more pressure and more insistent on making sure that we're passing legislation in the states and federally, and trying to advocate for the codification of Roe back into place because it is necessary to save lives. We have to make sure that we are organizing together and we are pushing legislation as really going to support a woman's right for bodily autonomy and a woman's right to make decisions for herself. So that's what we're seeing, how we've had to pivot more to push on a legislative front.
So how can you try to ensure access for women? And more importantly, how can the people who are here, public health professionals, help in that effort?
Well, we know right now that reproductive rights is on the ballot at this election. We have 10 states that are going to have ballot initiatives on the ballot where they're trying to enshrine into their constitutions at their state level, protection for abortion access and reproductive access. And it is so important that each state and each voter take the initiative to make sure that they are protecting, abortion and reproductive access. We know overall, majority of voters support a woman's right to make choices for her body and put those choices between that woman and her medical provider. So what we need everyone to do is really show up when it's time to vote and make sure they're voting for a woman's right to bodily autonomy and a woman's right to make those health care decisions for herself. So that's really what we need to see more than anything. We need everyone to show up at the polls and vote. Voting is going to make the biggest difference for everyone to be able to guarantee that. Because while we do not have it at the federal level, we can make sure the states pass it and enshrine them to their constitutions and protect at the state levels.
Do you have advice for public health professionals to begin that conversation to keep it going?
Absolutely. I think that one of the things they could do is exercise the power and exercise their education and what they've been taught, and make sure that their clients and their consumers are fully engaged and aware of their right, and they're informed and fully informed and have consent about every decision they make with their health care. I think the biggest thing we can do is continue to make sure people are fully informed and have consent about decisions that they make. When a person has consent, they make educated and appropriate decisions. And that's what we want people to do. We want them to know about their choices. We want them to feel engaged and empowered about those choices that they make. And so public health care professionals can do that to make sure that their clients, their consumers, their patients are fully informed and fully educated about decisions they make, so they're empowered to make the best decisions for themselves.
Well, thank you so much for all you do.
Thank you.